Rex. Good morning.
Thank you very much, Dr. Samadi. Thank you for
You're
doing
welcome.
a great job in bringing information out to the folks and your good support team there. Summit at the Summit. You can find more information at summitatthesummit.com with no spaces or underscores. It's basically a grand rounds, which, as you know, in medicine, a big meeting where all get together to discuss things. And what we're going to be talking about is saving patient health care for the patients and the physicians who serve them, because there are so many things going on right now with the burdensome insurance that's going on, the government over-regulation, that physicians are barely able to practice, and that keeps getting worse. And the patients keep losing service, losing time, and losing opportunity to keep their relationships with their physicians. It's brought to us by the United Physicians and Surgeons of America that are at letmydoctorpractice.org. Again, spelled in words, letmydoctorpractice.org. There's going to be lots of different speakers, and you don't have to be in Keystone, Colorado this whole next coming week, the 21st to the 26th, but you can also get it on the web at summitatthesummit.com, at letmydoctorpractice.org as well.
Okay, but the whole idea behind this is to do what? To keep the government out of patients' practice? Is that the whole purpose of the summit?
Right. The purpose of the summit is to restore the patient-physician relationship. That is to say, the one-on-one relationship of trust that, as you know, engenders healing and helps things to move forward. And unfortunately, in your exam room, Dr. Samadi, as in all exam rooms across the country, there's not only the patient and yourself and perhaps a nurse, but there's an insurance person, there's a legal person, there may be a hospital staff member, there's someone from the pharmaceutical industry, there's someone from the insurance industry, and there's 3 government employees, and one of them is with the IRS.
Okay, let me jump in, Craig.
That gets in the way.
I got you, but how, during this summit, what do you think is going to be discussed that's going to change some of the things that's going on in patients' rooms? And
right.
I think a lot of it also has to do with the individual doctors. I mean, you still are free to practice the way you want to practice, even though you may be afraid that if you don't accept those insurances or if you don't deal with some of these pharmaceuticals, etc., you may be missing out on patient volume, etc. But what's going to be discussed that's going to change things? Is it going to be like we're not going to have electronic medical records, or what is the highlight of this whole thing that's going
Well, there's going to be many highlights, Dr. Samadi. I'm glad that you asked. I'll be speaking on restoring health freedom to medicine. That is to say, getting patients in a position where they can use their votes in elections to move things in a better direction than the direction in which we're headed, to be active in their communities, to seek physicians and hospital systems as well as care centers that bring their needs first and don't look at, government reimbursement mechanisms first and rationing of care, because that's where we're headed. All socialist plans move in the rationing of care direction. When they can't control the cost or what patients need, they decide that, you can't have these things any longer, and that's